Niacin is one of the more effective agents for raising high-density lipoprotein, or HDL, or good cholesterol. HDL has anti-thrombotic effects, and this is due to its ability to protect the endothelial cells from oxidative and other injury, and to remove excessive cholesterol from the artery wall, preventing plaque formation that can lead to thrombosis. Before the development of statin drugs, niacin was commonly used to treat abnormal lipid profiles. Because recent evidence shows little benefit on the cardiovascular outcome by adding extended-release niacin to statin therapy, or from raising the HDL good cholesterol, niacin is no longer considered a standard of care for reducing cardiovascular risk. Nevertheless, niacin has demonstrated anti-thrombotic effects, including inhibiting a coagulation cascade enzyme called factor VII by reducing fibrinogen levels, decreasing the expression of tissue factor, suppressing plasminogen activator inhibitor 1, an enzyme that inhibits fibrinolysis, and lowering the blood viscosity and decreasing platelet aggregation. Vitamin B6, B12, and folate are needed for metabolism of homocysteine, high levels of which are associated with vascular damage and increased thrombosis risk. Lower levels of these B vitamins, especially folate and B12, and high homocysteine levels are associated with increased risk of atherosclerosis, stroke, and venous thrombosis. For example, in patients with atrial fibrillation, high homocysteine, often from a B12 deficiency, increases the risk of stroke by fourfold. In addition, pernicious anemia, a condition which impairs the intestinal B12 absorption, has a well-documented association with high homocysteine levels and an elevated risk of venous thrombosis. Lowering homocysteine levels through supplementation with folic acid and B12 has been shown to lower the risk of a stroke. In a randomized controlled trial, 10,789 Chinese adults with high blood pressure were treated daily with either Vasotec, a blood pressure lowering drug, or enalapril, along with 800 milligrams of folic acid, and followed for 4.2 years. Subjects with low platelet numbers and high homocysteine levels had the highest risk of stroke, and in this high-risk subgroup there was a 73% lowering in those who received the folic acid. In another controlled trial in stroke patients with a history of deep vein thrombosis, lowering high homocysteine levels by using folic acid and B12 was shown to reduce the rate of the deep vein thrombosis reoccurrence from 28% to only 4%. Green tea contains bioactive polyphenols known as catechins, the most studied of which is epigo-galligo-catechin gallate, or EGCG, and clinical trials and observation studies have found that green tea is associated with reduced cardiovascular risk due to increased nitric oxide availability, reduced inflammation and oxidative stress levels, and improved endothelial function. Research using blood samples from subjects who are given blood-thinning medications like aspirin suggests the EGCG can improve their antiplatelet effect without increasing the risk of bleeding. The EGCG was shown to inhibit inflammatory enzyme activity in the platelets and suppress inflammatory signaling, inhibit the expression of adhesion molecules, and promote the expression of NRF2, a protein that upregulates the antioxidant pathways in the endothelial cells. EGCG also inhibited the expression of tissue factor, a protein that triggers coagulation, on the arterial and the venous endothelial cells. In lab animals, the EGCG inhibited platelet aggregation, prevented thrombus formation in the injured vessels, and prolonged the bleeding time. Lycopene is a carotenoid and is found in high concentrations in tomato skins. Lab and animal research suggests lycopene can suppress tissue factor activity and inhibit platelet aggregation. Lycopene has been suggested to potentially prevent thrombosis through mechanisms like reducing endothelial injury, inhibiting oxidation of LDL, reducing inflammatory immune activity, and decreasing cholesterol synthesis. A meta-analysis of 28 observational studies found a higher intake of blood levels of lycopene was correlated with a lower risk of stroke and cardiovascular disease. Tomato pomace is a byproduct of tomato production, and it contains mainly the tomato seeds and the skins. Tomato pomace contains lycopene and a number of tomato flavonoids, and these may work together to inhibit the platelet aggregation and to reduce the thrombosis risk. In a placebo-controlled trial in 99 healthy young men, taking 1 gram of tomato pomace extract daily for 5 days reduced the platelet aggregation. Extra virgin olive oil is high in monounsaturated fatty acids and antioxidant polyphenols, and a high intake has consistently been associated with lower cardiovascular risk. Olive oil has been shown to lower oxidative stress and inflammatory marker levels, to improve endothelial function and lipid and carbohydrate metabolism, and to inhibit thrombosis. Preclinical research shows olive oil can reduce platelet activity and aggregation, reduce endothelial cell expression of adhesion molecules, and decrease the coagulation enzyme factor 7 and plasminogen activator inhibitor 1, both of which are implicated in coronary artery disease. Some evidence suggests olive oil can also mitigate the risk in coagulation enzyme activity that's typically induced by a high-fat meal. In one clinical trial in 82 patients with early atherosclerosis, 30 milliliters of olive oil per day for 4 months improved the vascular function and the inflammatory marker levels. Oleuropein and its derivative hydroxytyrosol are polyphenols and are found in olives, and these compounds have demonstrated inflammation and oxidative stress lowering properties, and they've been found to improve the vascular function as well as the glucose and the lipid metabolism. Findings from multiple preclinical studies suggest the oleuropein and the hydroxytyrosol and the other phenolic extracts from the olive oil can inhibit the platelet activation and the aggregation. Pomegranates are rich in flavonoids, tannins, and other polyphenols, and they have strong free radical scavenging and anti-inflammatory properties. In lab studies, pomegranate extracts have been found to reduce platelet activation and aggregation in response to thrombotic triggers. A meta-analysis of 8 randomized controlled trials found drinking up to 8 ounces of pomegranate juice per day reduced the high systolic blood pressure, and more than 8 ounces per day reduced both the systolic and diastolic blood pressure. In an open trial in 13 healthy subjects, drinking 50 milliliters of pomegranate juice per day for 2 weeks reduced the platelet aggregation by 11%. Another clinical trial found subjects who drank pomegranate juice exhibited prolonged clotting time 6 hours later. Pomegranate has also been found to reduce oxidative stress and high blood pressure, and to improve vascular function and glucose and lipid metabolism. A randomized placebo-controlled trial in 100 heart disease patients found 450 milligrams of pomegranate extract plus 180 milligrams of vitamin E as synthetic DL-alpha tocopherol daily for 8 weeks reduced the expression of 2 vascular adhesion proteins, and it lowered levels of inflammatory markers. In another placebo-controlled trial in 48 subjects who were overweight or obese, 1,000 milligrams of pomegranate extract for 30 days reduced inflammatory marker levels and improved blood glucose, insulin, and LDL cholesterol levels. Yerba mate is high in chlorogenic acid, and it has anti-inflammatory and free radical scavenging properties. In a randomized placebo-controlled trial in 142 participants with high blood viscosity, a condition that's related to an increased thrombosis risk, 5 grams of yerba mate tea per day for 6 weeks led to a reduction in the blood viscosity and improved circulation in the small vessels. Another controlled clinical trial found 580 milligrams of chlorogenic acid from the yerba mate per day improved markers of cardiometabolic health in 34 middle-aged men at high risk of metabolic syndrome. In preclinical research, a constituent from the yerba mate reduced thrombin activation and venous thrombosis. Some evidence suggests the yerba mate tea, when consumed in large amounts, and especially when consumed very hot, can raise the risk of esophageal and head and neck cancer. It's thought this is possible due to the presence of polycyclic aromatic hydrocarbons, and these are produced through a drying procedure involving smoke. Although a carcinogenic effect of yerba mate tea has not been confirmed, it's prudent to drink the tea at a slightly lower temperature and to limit the intake to less than 1 litre per day. Quercetin is a flavonoid and it's found in most fruits and vegetables, with high amounts in onions, apples, tea and wine. A higher intake of flavonoids, including quercetin, is associated with lower cardiovascular risk. Quercetin supplementation at doses of 150 mg and 300 mg has been found to inhibit platelet activation, signaling and aggregation within 30 minutes in healthy adults. Supplementation with 150 mg of quercetin for 6 weeks has also been shown to significantly reduce systolic blood pressure and oxidized LDL levels. Preclinical research has shown quercetin reduces the expression of adhesion molecules on endothelial cells and platelets. It lowers oxidative stress, inhibits LDL oxidation, supports nitric oxide production and healthy blood vessel function, improves glucose metabolism, and reduces inflammatory marker levels. Quercetin, along with other flavonoids, is thought to be responsible for anti-thrombotic and cardioprotective properties of bee products, propolis, and honey. Saffron's distinctive red-orange color is due to its carotenoids, including crocin and quercetin. Saffron extracts have been found to suppress platelet aggregation, to scavenge free radicals, lower oxidative stress, reduce LDL oxidation, inhibit the expression of endothelial adhesion molecules, and improve endothelial function. Quercetin alone has been demonstrated to have antithrombotic effect in lab and animal studies. In a randomized control trial in 84 subjects with coronary artery disease, 30 mg per day of crocin for 8 weeks lowered the oxidized LDL and an inflammatory marker, monocyte chemoattractant protein 1, or MCP1, and it inhibited the expression of genes related to atherosclerosis when compared to the placebo. Ginger is a culinary spice and a medicinal herb, and it's been clinically demonstrated to have cardioprotective effects, such as improving lipid levels, reducing the levels of inflammatory cytokines, lowering blood pressure, and inhibiting platelet aggregation. An observational study that examined the health records and the dietary survey from 4,628 participants found among those 60 years and older, those who reported higher ginger use had a lower incidence of coronary artery disease. Ginger might also be beneficial in metabolic disorders such as obesity and type 2 diabetes. In a study in mice, the active compound from ginger inhibited not only the platelet aggregation but also the activity of factor XA, an enzyme in the clotting cascade. Lab research also found a polysaccharide extracted from ginger inhibited coagulation pathways. A systematic review of 8 clinical trials was unable to draw a firm conclusion, however, about the effect of the ginger on the platelet aggregation in the human studies due to the small sample size and the varying methodologies. A single dose of 10 grams of ginger reduced platelet aggregation, however. Vitamin C is a water-soluble antioxidant, and it's demonstrated the ability to reduce platelet aggregation and to promote fibrinolysis without impacting coagulation pathways in high oxidative stress pro-thrombotic conditions in the lab. In particular, vitamin C appears to reduce the expression of adhesion proteins by endothelial cells and platelets. A large population study of more than 20,000 adults ranging from 40 to 79 years of age followed the individuals for an average of 9.5 years and found that those in the top quartile of baseline plasma vitamin C concentration had a 42% lower risk of stroke than those in the bottom quartile. A meta-analysis of 17 randomized control trials found vitamin C supplementation at doses of 500 to 2,000 mg per day improved measures of vascular function. Some evidence suggests vitamin C supplementation can improve atherosclerosis and other conditions associated with an increased risk of venous and arterial clots. but this effect is likely to be mild and of greater importance in those with lower vitamin C levels and higher cardiovascular risk. Positive effects on blood vessel dilation were seen in patients with chronic heart failure after taking 1 gram of vitamin C twice a day for 4 weeks. In smokers who've been proven in multiple studies to have lower blood levels of vitamin C, oral supplementation with 2 grams of vitamin C per day was shown to significantly decrease the urinary isoprostanes, which are markers of oxidative stress, and monocyte adhesion to the endothelial lining of the blood vessels, one of the early stages in the development of dangerous atherosclerotic plaque. Grapeseed is high in polyphenol, with health benefits based on its anti-inflammatory, oxidative stress reducing, and cardiovascular protective effects. Preclinical research has shown grapeseed has anticoagulant and antiplatelet properties. In mice, grapeseed extract reduced platelet aggregation without increasing bleeding. Grapeseed extract also reduced thrombus formation and spread in a rat model of deep vein thrombosis. A meta-analysis of 16 clinical trials found grapeseed extract significantly decreased systolic blood pressure in younger or obese subjects and individuals with metabolic syndrome. Capsaicin is the active compound found in red chili pepper and is responsible for the characteristic spicy taste. Capsaicin is used to treat inflammatory, metabolic, and infectious disorders. Preclinical and clinical evidence suggests the capsaicin can improve lipid and glucose metabolism, support weight loss, and lower the risk of both type 2 diabetes and cardiovascular disease. Lab evidence shows capsaicin has the potential to reduce platelet aggregation without affecting coagulation, in response to an array of pro-thrombotic triggers, possibly by inhibiting inflammatory pathways. However, in healthy male volunteers, neither 400 micrograms or 800 micrograms of capsaicin affected the platelet aggregation. Resveratrol is a flavonoid and is found in purple grapes, red wine, peanuts, soybeans, and berries. Its well-established anti-inflammatory and free radical scavenging effects, and this may slow the effects of aging on blood vessels. Preclinical research indicates resveratrol suppresses the effects of triggers such as collagen, thrombin, and oxidized LDL on platelet activation and aggregation. One study found resveratrol inhibited platelet aggregation and fibrinogen adhesion that was induced by stress hormone epinephrine. Some clinical evidence shows the potential role of resveratrol for protecting the cardiovascular and the metabolic health and improving conditions that are associated with the thrombosis risk. Extracts from Chinese ginseng, Panax notoginseng, are used intravenously in China to treat acute thrombosis, and some evidence suggests oral extracts from ginseng might also have the anti-thrombotic effects. Biologically active saponins, known as ginsenosides, are present in the Chinese ginseng, as well as the red ginseng or Panax ginseng, and American ginseng, Panax quinquefolium. An oral formulation of ginsenosides was found in a 28-day clinical trial to reduce the platelet aggregation. Preclinical research suggests the ginsenoside can inhibit the platelet expression of the adhesion molecules, platelet aggregation, and platelet reactivity to thrombotic triggers, and this can confer protection against excessive blood clotting. In addition, ginsenoside has been shown in lab and animal studies to reduce vascular inflammation and stiffness, stabilize atherosclerotic plaque, and slow atherosclerosis progression, which can help to prevent a thromboembolism. Ginsenosides can also improve vascular function by reducing free radical production, increasing nitric oxide, and reducing lipid levels. Ginseng and ginsenoside have anti-inflammatory and broad health-promoting effects, and this might benefit individuals with conditions that are associated with a thrombosis risk. Other compounds from ginseng may further contribute to its antiplatelet activity. Curcumin is a carotenoid and is found in the culinary spice turmeric, and it possesses oxidative stress reducing and anti-inflammatory properties. Its potential anti-thrombotic effects have been demonstrated in lab and animal studies. Both antiplatelet and anticoagulant action has been reported. Findings from preclinical studies indicate curcumin might be helpful in promoting endothelial repair and the resolution of venous thrombosis. In mice, a treatment with curcumin prevented the rise in inflammatory factors, blood pressure, and D-dimer seen with the exposure to air pollution, a common environmental risk factor that's known to increase inflammation and blood clot risk. The South American plant Resveratrol has been used traditionally to treat high cholesterol levels, obesity, and various inflammatory conditions. In preclinical research, the Resveratrol extract reduced platelet aggregation, prolonged coagulation time, stimulated fibrinolysis, and decreased inflammatory signaling in the endothelial cells. In a small controlled trial, 23 healthy adults were given either 1,000 mg of Resveratrol, 100 mg of aspirin, or 500 mg of Resveratrol combined with 50 mg of aspirin daily for 5 days. The Resveratrol inhibited the platelet aggregation more strongly than the blood thinner drug aspirin, and it had a synergistic effect when combined with the aspirin. In 2 clinical trials, the Resveratrol was found to reduce the total and the LDL cholesterol levels, lower oxidative stress, and increase endothelial nitric oxide production in the individuals with the high cholesterol levels. For more on herbs, supplements, and natural treatment plans, check out my website.